Hello, in this video, I will try to answer the questions you have about clotrimazole cream. If the video is helpful for you, don't forget to support my channel by subscribing and liking the video. What is clotrimazole cream, and why is it used? Clotrimazole is used to treat skin infections such as athlete's foot, jock itch, ringworm, and other fungal skin infections. This medication is also used to treat a skin condition known as pityriasis, a fungal infection that causes a lightening or darkening of the skin of the neck, chest, arms, or legs. How to use clotrimazole foot cream. Use this medication on the skin only. Clean and thoroughly dry the area to be treated. Apply this medication to the affected skin, usually twice a day or as directed by your doctor. Dosage and length of treatment depends on the type of infection being treated. Do not apply this more often than prescribed. Your condition will not clear faster, but side effects may be increased. Apply enough medication to cover the affected area and some of the surrounding skin. After applying this medication, wash your hands. Do not wrap, cover or bandage the area unless directed to do so by your doctor. Do not apply this medication in the eyes, nose, mouth, or vagina. Use this medication regularly in order to get the most benefit from it. Remember to use it at the same times each day. Continue to use this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. Things to know before using clotrimazole cream are as follows. Avoid using other skin medications on the areas you treat with clotrimazole topical unless your doctor tells you to. Avoid wearing tight-fitting, synthetic clothing that doesn't allow air circulation. Wear clothing made of loose cotton and other natural fibers until the infection is healed. You should not use clotrimazole topical if you are allergic to it. Clotrimazole topical is not expected to harm an unborn baby. Tell your doctor if you are pregnant or plan to become pregnant during treatment. It is not known whether clotrimazole topical passes into breast milk or if it could harm a nursing baby. Tell your doctor if you are breastfeeding a baby. Possible side effects of clotrimazole cream include the following: burning, stinging, swelling, irritation, redness, pimple-like bumps, tenderness, or flaking of the treated skin may occur. If any of these effects last or get worse, notify your doctor or pharmacist promptly. If the video was helpful, please like and subscribe to my channel. Feel free to share your thoughts and experiences related to medication use in the comment section below. Wishing you all healthy days ahead.